Hello friends, welcome to Kasam Healthcare Private Limited, your own homeopathic channel. Today we shall discuss a very new and totally different topic. Today's topic of discussion is Mesothelioma. We will like to inform you regarding Mesothelioma. It is a very rare and uncommon disease which is prevalent all over the world, but in India its ratio is something 1 lakh people, approximately 1 lakh people are suffering from mesothelioma in India. So you may like to know regarding this disease in details. First of all, we would like to brief you regarding this channel also, that Kasam Healthcare Private Limited is a private limited company which is registered with ROC Ahmedabad, and it is devoted to service of homeopathy. So it only deals in homeopathy and does nothing else. And you have an authenticity that you will get best services in homeopathy through Kasam Healthcare. So friends, stay tuned with us. Don't forget to subscribe our channel, and if at all you have subscribed our channel, then don't forget to press the bell icon so that you can get each and every update from our side. So here we go. We are just starting regarding mesothelioma. What is mesothelioma? Mesothelioma is a tumor of tissue that lines the lungs, stomach, heart and other organs. So it is a tumor which is lining the main basic mesothelial linings, which is inside lining of the main major organs like lung, stomach and heart and maybe other organs also, but these are the most prominently affected organs, and among them lungs are the most prominently affected organs. As we mentioned earlier, that its ratio is something 1 lakh in this India, and how it is caused. The basic cause of this mesothelioma is if you are exposed to this asbestos or any sort of chemicals which are constantly being impacted in the this lungs, then it can cause mesothelioma. But the main common cause is this asbestos. Now this is the malignant thing, and it mostly affects the lungs, as you told you earlier. Now what are the symptoms of this mesothelioma? So among the symptoms there is cough. Cough is continuously present. Then it will cause chest pain while coughing. Then there is shortness of breath, means the person is not able to take the deep breath. That breathing is restricted while inspiration or expiration. Then there is bloating of abdomen and nausea, loss of appetite is there. These are the common symptoms, and associated with that there would be weight loss, which is the most common symptom of this cancer. Another thing is fatigue, means very much patient will feel fatigue and weakness, and night sweats. Night sweats are also common, that excessive perspiration during night. These are the common symptoms which are present in mesothelioma. Diagnosis. Now diagnosis of mesothelioma. How you would diagnose mesothelioma? Mesothelioma is a disease which is not easily being diagnosed, and there are various tools to diagnose it. First of all, X-ray. X-ray has its own limitation, and it cannot diagnose properly mesothelioma. You can just see that there is a collection of pleural fluid, that is called pleural effusion. Only one thing is possible, that pleural effusion can be detected. That is one of the symptoms which can be only diagnosed by X-ray. Other means other higher things are also there, like CT scan, MRI. They also diagnose it, but the minimum tool which is needed to confirm this collection of fluid in pleura or pleural effusion is this X-ray. So X-ray is the most common tool and which is frequently, but you cannot properly confirm that it is due to mesothelioma. Pleural effusion could be due to n number of reasons. So that is not a conclusive thing. Then you may go for this MRI scan, CT scan. CT scan will definitely detect the location of the tumor or mesothelioma tumor, cancerous tissue, and it also determines the localized region where it has been stuck up. And for the confirmation you need MRI. So with MRI you can exactly determine that what all regions are being affected and whether this thing has spread or not. This will further help you out in prognosis of the disease. And full and final would be the PET scan. PET scan is utilized to determine the difference between scar tissue and the cancerous tissue. That can clearly determine the difference between these two things. So you will be able to easily diagnose this thing by PET scan. Means confirmation will be there by PET scan. Another method is also there by taking the taking biopsy or a certain tissue from the affected region, and with that you will be able to diagnose. But there are 50% chances that you may miss it in biopsy also. Biopsy can give false negative results. So that is not the confirmative thing. But in most of the cases with this MRI and positron emission PET PET scan, it could be confirmed. So these are the things by which you can diagnose this mesothelioma. Now we could go regarding prognosis. Well, prognosis for mesothelioma is very poor, and that too when the patient develops mesothelioma due to asbestos exposure, it is nearly zero. So it is very difficult to treat such kind of cases, so better to avoid them. Then comes the question of treatment, that what is the treatment for mesothelioma. So in mesothelioma there are various treatments depending on the stages of mesothelioma. First of all, we would like to discuss the general treatment which is applicable, that is a pleurolysis, means removal of the fluid from the pleura. Then thoracotomy, you have to open up the thorax and try to remove the affected tissue. That is thoracotomy while opening it. Radiotherapy is also one of the mode. Chemotherapy is also the associated mode. Both radiotherapy and chemotherapy go side by side. So both of these things are needed. Then there is another mode of surgery, that is surgical mode for treatment portion. In surgical mode there is a thoracotomy surgery, means you have to open up the thorax and remove the scar tissue or whatever the affected cancerous cells that are there that you have to remove. And pleurectomy, sometimes you need to remove the pleura also, and maybe lobectomy also is needed, that the whole affected lobe could be removed if at all you cannot remove the certain tissue. So these are the things which could be done. And as we explained earlier, that in this prognosis is really very poor. Most of the patients die out, only some few survive. So better you should be active, that you are not exposed to such things like asbestos, and continuous exposure to chemicals should be avoided, and if at all it is there, then with complete safety precautions. After the treatment, this was the routine treatment which is available in society and which is the first and foremost which the people prefer. But you can go for other option also, that is homeopathy. In the homeopathy also there are some medicines which could be very effective in cure as well as in a palliative mode. But it depends on the stage at which it has been detected. So if at all the mesothelioma is detected in first or second stage, then there are highest chances that mesothelioma could be cured. Means there is no spread out, or it has not spread into the other organs of the body. If at all it is diagnosed at that particular stage, then it can be cured completely. But in advanced stages like fourth stage, where it has been spread over multiple organs, so it is very difficult to cure it, and sometimes it is impossible. But then also we do have medicines in homeopathy which can definitely help you out in prevention of the progression of this mesothelioma. And suppose in routine allopathic treatment, if they have explained you or any other person, the patient, that the survival chances for this person is approximately 3 to 4 months, then you can easily carry that 3 to 4 months period to something 3 to 4 years, or maybe beyond that also, if a patient cooperates fully, and if diet management and all those stuff is well managed, then it is possible to increase the survival rate or the lifespan of the patient. And as we explained earlier, in first and second stages, it is not easy, but it is not difficult also. With specifically selected medicine in homeopathy, by taking complete case history, it is possible that patient can be cured. So as we mentioned that we need to take complete case history, and after complete case history, we can either cure the disease or palliate the disease. So this was the scope of homeopathy. There are certain medicines which are helpful in the cases of this type of diseases, like Silesia, Conayum, Phytolacca. All these things are very helpful, but these medicines cannot be taken without the prescription of a doctor. So better you consult the doctor and then only you take such medicines. They are very much effective and they give you very nice results. Now, as we explained earlier, that this thing is very, more or less mortality rate is very high. So we would advise each and every individual who is being exposed to, who is being continuously exposed to chemicals in certain factories, and especially in asbestos, where there is production, or if at all that person is dealing with asbestos, then we would surely advise that particular person or individual to take insurance, that is medical claim, and insurance should be there, that if at all anything happens to that person, then his family is not being disturbed. His family gets some financial aid, and they can definitely walk out in such a manner that they live their life very happily. So better you take insurance for that particular disease, not particular disease, but take insurance, so that if at all anything untoward occurs, then at least your family is safe. So friends, today for today this much is sufficient, and if at all you need to know more regarding mesothelioma and any other thing regarding homeopathic scope in mesothelioma, then you can write down in the comment section. We will definitely reply to that. Once again friends, we would like to remind you that if at all you have not subscribed to our channel, then do subscribe to our channel, and also click on the bell icon so you get regular updates from our side. So you will believe us, you will be safe and sound if you are with us. We will guide you from each and every step in each and every disease, and you will get very nice information also, and very nice resolution also from our side. So just stay tuned with us, subscribe our channel, click on the bell icon, share this video with each and every of your friends and each and every of your groups, so that each and every nook and corner of India and world recognizes this thing, and they can also suppose if any person is suffering from such a disease, then maybe this video could help him or her out, and they can get rid of this thing. So please friend, don't forget to share this video, share, subscribe, comment, and be with us. Stay tuned with us. Till then, bye bye, take care, bye.